Hello everyone, my name is Dr. Joel Rosen. I am an adrenal fatigue recovery ninja, and today we're going to talk to you about hyperthyroidism natural treatment. So first of all, let's talk about hypothyroidism. I think it's really important to understand because if you're dealing with fatigue and brain fog and you're feeling cold all the time and you can't lose weight and you're losing your hair and you have gastrointestinal problems and you have some cognitive changes, then those are all signs of a hypothyroid problem. And if your doctor is just looking at your blood work and saying, hey, you fit within the normal ranges, and they're not listening to you, then they forgot to put their doctor hat on, because part of the deal of understanding what a patient is going through is to really listen to them and not necessarily look at their blood test and say, hey, you shouldn't be feeling a certain way or you should be feeling a certain way based on your blood test. At the end of the day, you, the patient, trumps your blood test, number one. Number two, for having a hypothyroid problem, there's a lot of reasons as to why you can have that. It could be because your thyroid is just asleep on the job. And if that's the case, then typically your TSH levels are going to go higher. And that's when you take Synthroid or Armour or levothyroxine, and that helps you. But that's only 1/6 of the reason why someone would be dealing with a hypothyroid problem. The other reason that a person would be dealing for a hypothyroid problem is because there's an immune-based attack. And that means that your immune system is attacking your thyroid. And so today I want to talk to you about a patient that I had such a problem where she had an immune-based problem and she is taking hormones. It's not going to help her. So let's talk about what happened. Basically, we looked at her blood test and we saw that her TSH levels had gone up to 4.4. So 4.4 is a normal result, because in this particular blood test value, it was like 5.2 on the high end. So unless she exceeds 5.2, she's told she's normal. But from a healthy range, above 3.0 is considered high. And so why would we be hypothyroid with a high thyroid value? The reason it is because the thyroid is asleep on the job. And so the pituitary has to say, hey, you got to work harder. So it causes its TSH levels to rise. But unless it's higher than 5.2, they're not going to be told that anything's wrong. However, from a functional range, it should be below 3.0. So she is functionally high. However, she took her blood test 3 months ago and she was like 2.1. So she was actually in a good range, and she's taking, I think, 15 micrograms of Synthroid per day. And so, 3 months later, we look at her thyroid levels and it's gone up. What's the doctor typically going to do? He's going to say, oh, you're not on enough thyroid medication. We got to give you more. But here's the thing. She had TPO antibodies. TPO antibodies should be less than 24. And she had 240. Her thyroid antibodies were high. So what happened in that 3 months time? We don't know what her TPO antibodies were like prior to the test. But we know that her thyroid TSH levels went higher, and we know that her antibodies went higher as well. What's happening is she's having an immune-based attack on her thyroid. So it doesn't matter how much hormone she takes unless she addresses her immune-based attack. Does that make sense? I mean, you can continue yelling at the thyroid, hey, work harder, work harder. But if someone's causing an attack of that thyroid, you're not getting to the root cause of the problem. Another patient I talked to today, she actually had TBG antibodies. So she was negative for TPO antibodies, but she had TBG antibodies, thyroid binding globulin antibodies. One's an enzyme that helps make thyroid hormone be synthesized or made. One's a protein that delivers the thyroid to the liver so that it can get converted into a natural usable form. T4 is the main hormone that thyroid makes, and a lot of the times your doctor will measure you for that. But T3 is the actual active component. 60% of that conversion, like the coffee bean, T4 is the coffee bean. 64% of grinding that coffee bean down into grinds into T3 takes place in the liver. So if you have a liver problem, if you have toxic overload, then it doesn't matter, again, if you have an antibody, or it doesn't matter if your TSH isn't working well. You have a liver problem. You have a conversion problem. That's another reason why you could be having a thyroid problem. Taking Synthroid is not going to fix that. cleaning up the gut and reducing inflammation and addressing any toxic exposures and heavy metal toxicities and environmental pollutants and methylation issues are going to help the liver. But one of the things I want you to know is she had her cholesterol levels were 210 and her triglyceride levels were like 179. When we see a high ratio of triglycerides to cholesterol, we know that that person is insulin resistant. And in fact, her glucose was like 101. Her doctor would have said, hey, your sugar levels are fine, but they're not fine. She has insulin resistant. She is eating way too much carbs and she's not eating enough fats. In fact, we did a fatty acid panel and we saw that her omega-3s were low. So what were my recommendations? My recommendations were she needs to get at least 50 to 60% of her calories from dietary fat. So that means seeds, nuts, coconut oil, ghee butter, avocados, higher meats with higher concentrations of fats. She needs to control her carbs to less than 20% of her total calories. And I told her that's about 75 grams per day, which is really low. And so her homework assignment was to leave and try to determine how much carbs she was taking in a given day. And guess what she told me? She told me that's the exact opposite thing that her doctor told her. Her doctor told her to eat less fat and eat more carbs, which is the exact opposite thing that she should be doing. In fact, I was in Starbucks today and I saw a lady ahead of me. She was very, very overweight and she ordered a venti, the new butterscotch frappuccino, and she said skim milk. And I took a breath and I thought, okay, adrenal fatigue recovery ninja, don't tell her that it's actually the sugar that's in there that's causing her insulin resistance, not the fact that there's fat in there. In fact, you should be eating fat and you shouldn't be eating sugar. But anyways, I took a deep breath and I let her do her thing. So anyways, a lot of things going on here. Number one, do you have a thyroid antibody? Number two, if it's not against TPO, maybe it's against thyroid binding globulin. Number three, are you functionally high with your thyroid level? If you are, that doesn't necessarily mean you need to go on more or less hormone. Number four, is there a liver congestion problem? How well are you converting? Number five, is there an insulin problem? Are you eating too much carbs? Is your triglycerides levels too high compared to your cholesterol levels? Number six, are you not eating enough healthy fats? Are you eating too much carbs? Those are a lot of things that you need to figure out, and if you do, that's going to give you a hypothyroid natural treatment protocol. So my name is Dr. Joel Rosen. I give free 15-minute phone consults to troubleshoot with you. My job is to try to help you recover from your chronic condition, and I look forward to helping you in your thyroid recovery nightmare.